What's up, guys? Welcome back to the nursing channel. Before I start, don't forget to subscribe, or after this video, please subscribe, guys, because I really appreciate your guys' support. All right, so I'm going to answer the question: is nursing a good career choice? Heck yes, it is. That was easy. Definitely, nursing is a great career choice. If you're thinking about becoming a nurse, 100%, you should do it. No hesitation there. I'm not just saying that because I'm a nurse. I'm saying it because I truly mean it. Nursing is such a versatile career option because there's so many different things that you can do as a nurse. A lot of people think, there's this misconception, a lot of people think that like once you become a nurse, you get your license, you have to work with patients, like giving them medications, wiping their butts, cleaning up poop, taking them to the restroom, giving injections, doing wound care, and that's the only thing that you can do as a nurse. That is a big fat lie. As a nurse, you can work with computers. As a nurse, you can travel, do travel nursing. Like agencies will actually pay you as a nurse so you can travel to different places. You can travel outside of the country and you get paid. And these agencies not only pay you for working as a nurse outside of the country, but they also pay for your housing. They give you a weekly allowance. So there's a lot of perks to becoming a nurse. And also you can also do travel nursing within the States. And a lot of people actually do that because they get to see the world without having to pay money out of their own pocket. So nursing is great. Also, with nursing, if you just want to work with kids, you can do that. Become a pediatric nurse. If you want to work with pregnant moms, you can be a labor and delivery nurse. If you only want to work with elderly people, you could become a geriatric nurse. If you don't want to work with patients at all, you can go into administration, or you can become a nurse case manager, which is what I do currently. And man, that is super. I'm so happy with my job because I don't have the personality to clean up poop and give medications and have to deal with angry families and try to juggle all the madness at once. You have medications, you have patient family members that may be upset or have a lot of questions, and patients that are complaining of pain, that they're in pain and they want pain meds. And so as a bedside nurse, you're juggling a lot of things. You don't really have time to get to know your patients and ask them questions and just build a relationship. And as a nurse case manager, I don't do patient care, but I still have the opportunity to interact with patients, which is very nice. A lot of my job consists of sending out forms, communicating with the doctors, the medical team over the phone, documenting, talking with patients over the phone, or sometimes seeing them in person, and gathering information. So yeah, as a nurse, there's so much that you can do. It's ridiculous. So if you're thinking about going into nursing, I highly recommend it. Nursing is not only is nursing a rewarding job because you're helping people, but it's also a very good paying job or career. Like, let's face it, guys, like me, like a lot of us come from poor families, right? Families that are struggling to pay ends meet, to pay the bills and stuff like that. So once you become a nurse, you won't be struggling because nurses are paid very well, and there's different opportunities that you can take to climb up that pay ladder, which is nice. With other jobs, you kind of stay stagnant, and it's really hard to get like a raise or move up in the pay ladder within an employer. So that's another plus to doing nursing. For me, for example, I grew up in a single parent home. My mom raised 3 of us, me and my two siblings. And yeah, my mom was struggling to pay the bills. As a single mother, she had like a minimum wage job. And, I grew up in South Central LA, which is the hood. It's not a good neighborhood. And yeah, my mom was struggling to try to pay the bills. And then, I went into school. I took all the prerequisites, got into nursing school, and thank God I graduated and I became a registered nurse. And once I started working as a registered nurse, man, all those money problems just went away, and I was able to help out my mom, help her pay for her bills, help her pay for her home. And me, I was able to, buy the things that I always wanted in life. I was able to buy a brand new car. And yeah, man, so if you're thinking about doing nursing, I highly recommend it. There's other jobs like becoming a doctor. Like, who wants to spend like 8 to 10 years of their lives just going to school? It's like, it's bad enough that you're in the school system from kindergarten all the way to 12th grade. Then you got to go to college and then do another 10 years of schooling. By the time you graduate as a doctor, you're like, what, 40, 50 years old? You like wasted away all your youth just going to school, studying, breaking your head, being stressed out, so you can enjoy the last 20 years of your life. That doesn't make sense to me. That's why I decided to become a nurse, because it's a shorter career path. It only takes a few years, and then once you start working as a registered nurse, you get paid well, and and at the same time you're helping people, which is a rewarding job, and you get to do things like travel, be able to buy your own home, buy a brand new car if that's what you want, whatever it is, or help out your family members, whatever it is, you can do it as a registered nurse, and that's why I highly recommend nursing. So if you are a person that's aspiring to be a nurse, go for it, and just be dedicated, because nursing school is not easy. If you ask other nurses if nursing school was easy, it was not easy. Nursing school was probably one of the hardest things I've done in my life, if not the hardest. So if you're thinking about it, definitely go for it, but be strict with yourself and be dedicated so that you can pass your exams in the nursing program and eventually graduate and become a registered nurse. So take it seriously if you are just thinking about going into becoming nursing. So that was it. My name is Sam. Thanks for visiting the nursing channel, and don't forget to subscribe. And if there's any specific topics that you want me to discuss or talk about, let me know. Put it on the comment below. I'll see you guys later. Take care.